Welcome to the Workology Podcast, a podcast for the disruptive workplace leader. Join host Jessica Miller-Merrill, founder of Workology.com, as she sits down and gets to the bottom of trends, tools, and case studies for the business leader, HR, and recruiting professional who is tired of the status quo. Now here's Jessica with this episode of Workology.
Welcome to the Workology Podcast, sponsored by Workology. COVID-19 causes a fever, a cough, and shortness of breath. More than 89,000 people have been infected worldwide, and more than 3,000 have died. In the United States, more than 164 cases have been reported nationwide, including the first confirmed case in New York City. This comes to us as of Friday, March 6th. While the CDC is working with the Department of Health and Human Services, and across the U.S., governments are helping with public health response to this potential crisis. Those of us in HR are looking for guidance on how to protect our workplaces and employees from the spread of the coronavirus. More importantly, we're looking about how to communicate to our employees on what to do. Many large companies, including Amazon and Google, have begun to restrict non-essential travel and all travel to specific countries. I have read reports about employers wanting to restrict vacation to certain areas as well. Should small-sized companies follow suit? Today I'm talking with Dr. Mark. He's the owner of the Functional Medical Institute located in Tulsa, Oklahoma. And we're talking about what HR leaders can do to support our employees. Dr. Mark, welcome to the Workology Podcast.
Thank you, Jessica, for having me. It's quite an honor to be with you.
It's been all over the news, and we've seen an increase in the coronavirus diagnoses in so many countries, and now it's here in the United States. First, what should we understand about this virus? What do we need to know?
Well, it's important to understand that, first of all, different types of related viruses can cause things that we're familiar with, such as chickenpox, smallpox, and even monkeypox. So further, when you look at these different coronaviruses, they cause different diseases in people. For example, the severe acute respiratory syndrome, known as SARS, coronavirus causes SARS. And the Middle Eastern respiratory syndrome, MERS, coronavirus causes MERS. So this new sort of novel coronavirus known as COVID-19 is one of roughly 7 types of known human coronaviruses. And COVID-19, like MERS and SARS coronaviruses, they likely evolved from a virus previously found in animals. The remaining known coronaviruses cause a significant percentage currently of colds in adults and children, and they're not really a serious threat for otherwise healthy adults. And Jessica, all these viruses accumulate these mutations or changes over time, and the virus that causes this COVID-19 is no different. So these mutations, now changed, become much, much harder to identify and then control.
So you said, and I just want to repeat, that COVID-19 is no different than other viruses, right?
Well, I want to make sure the parameters are correct with that one. It's no different than other viruses in that how it responds and acts and mutates.
Okay. How should our response be different to the coronavirus than other infectious diseases like the flu and the others that you mentioned?
It's funny you mentioned that because I've read some material in preparation for our interview today, and some indeed claim that COVID-19 is no more deadly than the flu. However, as I was discovering even today, there are some very new reports indicating that there may be 2 separate strains, one of the strains being more aggressive of the coronavirus that has accounted for roughly 70% of the analyzed strains so far, and they call this strain the L as in Lincoln type, while 30% have been linked to the less aggressive type, which is labeled the S as in Sam. So it's interesting that the COVID-19 turns out at present, if it continues on its rate, it's about 10 times more deadly than seasonal flu, which is indeed, speaking of flu, estimated to kill 250,000 up to 650,000 people per year globally. In the U.S. in 2019, last year, we lost about 12,000 people from the influenza virus.
We encourage employees to get flu vaccinations, and most companies, most of our employers even offer these vaccines annually at no cost to the employees. And I feel like this is a good move, and it also helps us maintain a healthy workplace. So there's no vaccine for the COVID-19 yet, as I understand. Should we still be getting our vaccinations if we haven't, or what can we do to help prevent?
That's a really, really good question, because there's a lot of discussions on both sides of the coin regarding vaccines. There's a lot of ties, some say with the mercury in them to things like autism. However, let's look at the action of a vaccine. It brings in the actual virus so that the body will create an antibody or a warrior that goes against that thing. So you're bringing in something so that the body will adapt. It is important for us to understand that by building a proper immune response, that a proper response then to a vaccine coming in would be wonderful, because it would give you the ability to fight that particular virus when it comes in the next time. So overall, the answer is absolutely, there's nothing to fear with or be concerned with a vaccine, and we should do that because it's prevented diseases. I mean, my goodness, without the vaccines, we perhaps might not be having this conversation. So they are miracles indeed. But let's also understand that if a vaccine comes into a system that's already immunocompromised, that has all kinds of inflammation riddled in it, and that vaccine comes in to an already dysfunctional system that's not operating correctly, that vaccine could indeed be something or one of the things that was the tipping point to cause the body to go into some sort of autoimmune capacity. So, I think the two sides of that coin is, one, we build up our immune system with a healthy immune system, they work great. With an unhealthy immune system, really, there's a potential they won't work as well. And in fact, nothing will work well.
So let's assume that we're healthy, right? What can we do to stay healthy? What are some ways to prevent the coronavirus?
Yeah, so I came up with a good list that I distributed to our employees, and here they are. And I came up with about 15 things, and then I came up with another list of, if you will, things you don't need to do, right? So if you look at the don't do's, that's going to give you immunocompromised action. So let's look at the immune powering ways that's able to create this great, I call it a war machine, which is a healthy immune system. Number one would be to, first of all, don't panic with all the hysteria, and don't live in fear, because that very complex and though normal response will compromise the immune system by producing massive amounts of cortisol, that stress hormone. Number two, obviously we need to maintain adequate sleep, because if the body is not getting 7-8 hours of sleep, where we're completing our, generally speaking, 4 sleep cycles, we are not going to be able to properly detoxify, properly reset, properly regenerate, and recover. Interestingly enough, in America, we have this idea of shaking hands on greeting. I think that because of the way that the coronavirus is passed on, probably going to the old knuckle bump is probably a good thing to do. That would be smart. It is kind of a change, but I think that is probably a good move for a lot of reasons in all fronts most times. If possible, when you cough or sneeze, or anyone does that, do it into a tissue or some kind of disposable, napkin or something like that, and discard it. If there's no tissue around, do it into the elbow, and then remember that the clothing that you just sneezed or coughed into will indeed or perhaps contain this infectious virus that can be passed on for up to a week or more. When you open doors, touch doors, bathroom doors, etc., it is, post office, things with a lot of people touching this thing on a frequent basis. Try to use your hip or a closed fist. That's important. Another one I came up with is colloidal silver. So silver is an antimicrobial, antiviral, and colloidal silver is very much and readily available at pharmacies. So you can spray this on your hands, you can spray it up your nasal passages, spray it in your mouth, wipe down seats that are frequented by multiple persons, such as airplane seats. Another one, ozone. Ozone is great. You can use that in your house, hotel room, or car. We know that indeed enhanced oxygen treatment can quickly improve function of the immune system, as well as helping with detoxification and the killing of harmful pathogens. One that we have used here, Jessica, is very unique. It is the peptide thymusin, and that's Thymosin alpha 1. It is a peptide that normalizes the proper immune response. So this peptide may be a little bit novel and relatively new, but it's a way to reboot the immune system. I did a little bit of research as stated, and I found that coincidentally and ironically in China, back when there was a SARS outbreak several years ago, and I think we all remember that, killed a lot of people, but there was a lot of trials that they were using thymosin as a prophylactic or preventive sort of peptide, and those people did not get sick. And then they had another group where that were infected, and they gave one half the group thymosin, they gave the other group nothing or placebo, and they found that the thymosin group fully recovered much faster, and some of the other ones perhaps did not recover. So thymosin is a peptide, has been used with much success. We use it here in our office extensively for just improvement in immune response in general. It is important to know that is typically given through a subcutaneous injection. Another one is infrared sauna. I mean, those are beautiful. Improves detoxification, speeds up healing. We get into this idea of what we can take. Now, this is where you get into the things like a vitamin C. We know vitamin C is antiviral. Unequivocal, it is. So you could take up to 3,000 to 400 milligrams per day orally. It's recommended. Personally, I take about 4,000 a day every day and have for years. The only fallback, if you will, if you get too much vitamin C too fast, it can cause loose stool. In very acute situations, it has been done before, 10,000 to 20,000 milligrams per day can be quite successful, even up to some cancer corrective techniques. IV vitamin C is also likely beneficial. Pharmacies all have zinc lozenges, so those are beautiful. We should be doing those things anyway quite often. They're effective at blocking the coronavirus as well as most other viruses from sort of multiplying in the throat and the nasopharynx, of course. Then you've got vitamin A, incredibly good for that at 5,000 to 10,000 IUs a day. Vitamin D, 5,000 to 10,000 IUs a day as well. And probably this is very important to building the immune system, Jessica. It's eating real food. Wow. I mean, the standard American diet's deadly. It's killing more people than the coronavirus ever thought about doing on a daily basis around the world. We need to eat more food that's certainly real with fruits and vegetables. And when selecting, we need to use criteria, if you will, of organic, grass-fed and grass-finished, hormone, antibiotic-free, free-range, wild-caught, etc. Certainly, I think activity is good. We need to, I put a bottom limit on people's activity. I want 150 minutes or more of moderate activity per week, and that would mimic or match the American Heart Association recommendation. My wife and I, Dr. Michelle, try to get most of our community base up to 250 or more per week. And then finally, and this is one that we have to get in, it sort of loops back to number one, we have to become, and I call this disease confident. Disease confident is simply not expecting to get sick. And that would be, one puts those things into practice, you're going to have a very, very good immune system.
I like that. Mindset is everything.
It certainly is. And I think that, what we say will be a precursor or a lead-in to what chemicals the brain secretes. And the chemicals the brain secretes can be, as stated earlier, some that will drive the immune system in the incorrect direction, or some that will drive the immune system in a correct direction.
Let's take a reset. This is Jessica Miller Merrill, and you are listening to the Workology podcast sponsored by Workology. Today we're talking about employee response to the spread of the coronavirus with Dr. Mark.
Are you tired of putting your professional development on the back burner? It's time for you to invest in yourself with Upskill HR by Workology. We're a membership community focused on personal development for HR. Gain access to our elite community, training, coaching, and events. Learn more at upskillhr.com.
Do you feel like we're at a point now where we should be encouraging employees to stay home or work from home if they're able? I've seen a lot of companies here in the Austin area that are doing that, but what are your thoughts?
Yeah, I think that if a person has a temperature, running a higher temperature, they're contagious. I mean, that makes sense for everybody. If you're overtly sneezing and sniffling and coughing, well, that makes sense. But at the same time, if you're not running a temperature and you're not sneezing and coughing as much, and I think there consideration can be done where you could go to a workplace, take the precautions that I specifically laid out for you. Also looking at the type of work environment. Now, some people have a cubicle environment, some people an office environment. Some people have a lot of interaction with the public, some don't. So I think that needs to go into your discussion tank. And then finally, is someone or do they have the ability to work from home and be effective? All that said, it's a yes, potentially no answer to that question. But overall, we need to expect, again, not to be sick, expect to recover if we do get sick, and expect to be well all the time. And companies should not completely plant a seed. And now what I mean by that is a seed, if they put out a lot of stuff that is more negative based and fear based, then, and certainly concern is not what I want to minimize. We need to be concerned, but we need to plant seeds also on the good sides. For example, if employees, we put out, here's the symptoms you want to look for, but if you don't have any of these things, we'd love to have you back. Be here. We need you. That kind of thing. Make sense?
Yes. Well, so my next question for you is, you mentioned all these healthy things that we should be trying to do for ourselves. And I wondered, how can HR and business leaders encourage and help support their employees and helping them prepare for physically to prevent the coronavirus, but also if there is a worst case scenario, what can we do as employers, or what should we do?
Well, certainly the greatest thing we as employers can do is support our workforce with encouragement, equipping them, and ensuring they really have everything they need. This may sound a little bit odd, but certainly it is very valid. We talked about things that would strengthen the immune system, but let's talk about some things that we employers might not think about that we actually do that would weaken the immune system. We've talked about things such as a healthy diet. There are things that are not healthy. The standard American diet is not healthy. As stated, it is deadly, and some of the things that we put in our mouth will crush an immune system. They are not food, and were never food, and likely contain toxic carcinogens. Some of those examples, believe it or not, right today, and they're in vending machines around everywhere, is some of this the breads, the grains, the sugars, monosodium glutamate known as MSG, soda, fried foods, soy products that are genetically modified. So we need to sort of encourage a healthy environment. When we have meetings, business meetings, don't fall for the old trap that we're going to have chips and dip like we always have. Try to mix in some nuts and seasoned fruits, and you're going to find that you're going to create more engagement anyway, because the people know you're investing in their health. And I think another thing with that is promote a very controlled stress environment. In other words, if you as an employer recognize an employee as being overwhelmed or in a state of upheaval, it is probably a good idea to instruct them to go take a walk or get some air, and certainly don't overwork them either. Everybody has deadlines. But as stated earlier, if we don't get adequate sleep, that will compromise our system. And over the time, we'll have, and just like the population right now in the U.S. we're getting more sick people than we are population growth. Let's create a workplace environment where we get more well people, and that will in turn give us more profitability, more return on our investment through these individual people. And I think that will pay off dividends well into the future.
There are a lot of different companies that are out there that are restricting non-essential travel. So Google and Amazon are a few. Microsoft is also on the list, and conferences have also been canceled. I'm here in Austin, so a lot of people are thinking about travel and how the employees and also businesses might be impacted. What are your thoughts on handling employee travel or even vacations to maybe out of country? What do you recommend for employers to consider, or maybe to possibly cancel travel plans?
Well, first of all, if it's mandatory travel, we want to look at the countries that have been most affected. Where are we going, et cetera. So I think if it's one of the well-known affected countries, we probably want to restrict those for a time and delay if possible. If it's something that just has to be done and each employer understands that it has to be done, and the employee that's going understands that, take the precautions that we talked about and do everything you can to prevent the potential infectious agent hitting you. Overall, I think for business, the line is right now, when in doubt, probably restrict. As far as vacations goes, again, that is an immune builder, if you will, to get away, detach, stick your feet in salt water, etc., to not be around large crowds of people and perhaps detach a little bit from the scene, if you will. Again, depending on what country you're going to, etc., that would be something I would more lean towards than a business travel at the moment. Now, with that said, I think that certainly we don't need, again, to have a bunch of fear around that, but nonetheless, act with a little bit of delay, if you will, because it won't be forever. So if you have a situation that can be delayed a couple of months, give it time. I fully suspect that the pharmaceutical geniuses to be will come up with some kind of vaccine, and I think we'll be better off for it in the long run.
So one of the things that I'm hearing from a lot of HR leaders right now, I talked to one this morning, and she spent basically the entire morning putting together messaging that would be sent out to the organization in terms of suggestions, best practices, how to help employees, quiet their maybe fear or worries, especially those maybe who are really panicked. What advice do you suggest? Is it just the steps that you mentioned, or maybe what did you share with your employees to prepare for or to prevent coronavirus from spreading?
Yeah, we told them, of course, not to panic, and we're all affected. This is a non-critical statement of media, but we know that media has to broadcast things that, potentially, and everybody knows this, can create this sense of mass hysteria because it's so consistent, so bombarding our airways and minds and thoughts and conversations. What we did with our employees is very simple. I've told them we are coming up with a statement. We will address it. We will equip you with what you need to be resilient. And that was our word, to be resilient. We're going to give you all you need to do to make sure that you and your families are kept safe. And we gave them instructions on how to build the immune system. We told them how protective and amazing our bodies are at abilities to protect us from dangers we face simply as existing as a human on this planet. And we have faced these particular, potential pandemics before, and we have survived, and we are smarter for it. We know more. So we took the positive high road with that, and it did serve us well. We didn't have the pushback or anything like that I kind of expected. So I think to instill not over panicking, but more be prepared proactively.
So the CDC recommends avoiding exposure, which you talked about, and then washing hands. Is there anything else other than what we talked about earlier as far as prevention that we might have missed?
Yeah, I think probably, we really want to know, it's important to know the details of how this is spread, right? If you know how it spreads, you can take what you would know to be reasonable precautions. So it's spread in large droplets by this coughing and sneezing, and this means that the air itself is not going to affect you, but it's the surfaces where these droplets land that are infectious. And this is a big deal, Jessica, for about a week on average. So everything that is associated with these infected people will be contaminated and potentially infectious. So the virus would be on surfaces, and you'll not be infected unless your unprotected face is directly coughed or sneezed upon. So the virus only has cell receptors for the lung cells, which means it's only going to affect your lungs. So the only way for the virus to infect you is through your nose or mouth, or via your hands, or an infected cough or sneeze onto or into your nose or mouth. And so just take normal precautions to wipe down surfaces, wash your hands, watch hand to mouth or hand to eye contact prior to washing, and we should be fine.
Well, thank you so much, Dr. Mark, for taking the time to chat with us today. Where can people go to learn more about you and what you do?
My wife and I's website is www.f as in functional, M as in medical, I as in institute, D as in doctor, R as in Robert.com, www.fmidr.com.
Awesome. We'll link to your website and additional resources and information, including the CDC recommendation, in the resource of this individual podcast episode.
Thanks for having me, Jessica.
Thank you. Bottom line, we should be prepared. We should take a look at our operations and find out what can be done remotely. And we should identify key personnel on site, ensure they are taking the right and proper precautions. What we don't want to do is cause a panic. And we've seen that in the stock market. Maybe you have went out to buy face masks, or you tried to make a run on toilet paper only to find there was none in your local Costco. Lots of pharmacies are sold out of all these type of things, and grocery stores. And people are stockpiling pantry and personal items. Add me to the list of people who has done that as well. It is an uncertain time, but our role as HR leaders is to support our workforce, be reassuring, and give them as much information as we can, and create an infectious disease outbreak response plan. It's better to be prepared and plan for various scenarios than to try to figure this out as we go along. Dr. Mark said, don't live in fear. It will make you sick. I think he has some great tips and advice. We'll link to some great resources in this Workology podcast episode. However, the key is don't live in fear. Take care of yourself, take care of your family, and make good and healthy decisions and choices. Thank you for joining the Workology podcast, sponsored by Workology. This podcast is for the disruptive workplace leader who's tired of the status quo. This is Jessica Miller Merrill. Until next time, visit Workology.com to listen to all our previous podcast episodes. You can learn more at Workology.com.